edge of dying or on the edge of pain. It's terrifying, but it comes down to a moment where you have to really think, is this life going to be one you're going to be proud of or not?
We just thought it was very inspiring. And singing is just so great for your lungs. It's even, you know, like when you think about when you do breathing exercises and you're breathing in, you're blowing out your air, you're doing exactly what you do when you sing. So everybody, I want you to sing. Are we ready to start again? Okay. So our next speaker is Dr. Noah Greenspan. He has a huge biography in your notebook, so you will see. Wrap it up. He's really a wonderful person, and he's here to talk to you about ultimate pulmonary wellness. He's the program director at the Pulmonary Wellness and Rehab Center right here in Manhattan, right across the street from the American Lung Association office. So we discovered him, and we're so happy that he's here to speak with you today.
Thank you. So I'm gonna try to top that, but every breath you take. No, all right. So can you hear me now? Yeah. All right, good. So if there's one message I want to send you home with today, it's that you have the ability to change your life. Right now, right when you leave here, starting today and starting tomorrow. When it comes to what I do, I see patients with COPD, emphysema, chronic bronchitis, pulmonary fibrosis, lung cancer, pre and post surgery, lung transplant, and pulmonary hypertension. So those are the patients that we see every day. And the overwhelming thing that every single one of those patients has in common is shortness of breath. Now, there's one thing that people don't understand about shortness of breath, which is that shortness of breath is not only a reflection on your lungs and your respiratory system. It is a multifactorial process that could have something to do with your breathing. It could have to do with your lungs. It could have to do with your heart. It could have to do with the fact that you've gained 10 pounds over the winter. It could have to do with the fact that you were tired, and whereas before you used to take 40 flights of subway stairs every week, and now you're not taking any. So it's really important to understand that just because you feel more short of breath, that doesn't necessarily mean that your lungs are getting worse, okay? And over the past 25 years, there are things that we've found and that I've come to believe are the 5 most important things that you can do to change your life. And it's gonna sound like a lot, but you don't have to do every single one of them 100%. If you make small changes in each one of these areas, you will see a significant change in your life. And each one of these things that I'm about to talk about, I feel are 20% of the big picture, and I think they're all equal because they're all important, okay? So the first 20% I consider medical. And when I'm talking about medical, what I'm talking about is number one, having the right doctor, taking the right medications, and crucial to this, taking the medications properly, okay? One of the ironies about pulmonary medications is for the people that have the most difficulty coordinating their breathing, all of the medications that you take require a tremendous amount of breath control and coordination of your breathing. So a lot of times people say, well, I have this inhaler, but it's not doing anything for me. And then we ask to see them do it, and they're doing it completely wrong. So it's like if I say I have a headache and I have my Tylenol, and I throw it over my shoulder, it's not going to do anything for my headache. And it's the same thing with the respiratory medications. So medical is having the right doctor. Now, how do you know if you have the right doctor? Okay, there were already many great things mentioned in the earlier presentation, so I'm not going to beat a dead horse, but you need to have a doctor who A, is going to listen to you, B, is going to explain things to you, C, is going to answer any questions that you may have. If that's not the case, and we all know what makes a good doctor and we know what makes a bad doctor, and sometimes I think a lot of times people feel like, well, this is my doctor, he's always been my doctor, he's always going to be my doctor. But if a relationship is not working, just like any other relationship in your life, it may be time to move on. Now, I'm not looking to lead a revolt and get you all to leave your doctors, but if it doesn't feel right, it's probably not right. We know when we're getting good care or not, okay? In my opinion, people with pulmonary disease should really have 3 doctors, okay, or 3 main doctors that we talk about, okay? Obviously a pulmonologist, okay? I think it's worthwhile to have a good internist, and in this city, they're very, very difficult to find. And I think it's important to have a cardiologist, or at least have a full cardiac workup, because very often, you know, we talk about the pulmonary disease and the cardiac disease, but it's really cardiopulmonary disease, and it is the same system. So regardless of the fact that they have different chapters in the book, the cardiopulmonary system is very, very closely related, and a lot of times you can't tell if a symptom is related to your heart or your lungs or your acid reflux coming up, okay? Because between the neck and the belt, there are about 6 different systems, and a lot of the symptoms are very similar. So shortness of breath, chest pain, chest pressure, burning. And again, it could be your heart, could be your lungs, could be your stomach, and your GI system. But one thing I don't like is I don't like surprises, okay? I like to know what's going on and deal with all the information. So having the right doctor, taking the right medications, okay? A lot of times people will come to me, they'll have their bag of medications. How many people here take inhalers? How many people take more than 2 inhalers? Okay, how many people take 3 inhalers? How many people take 27 inhalers? No. Okay, so here's the thing. So a lot of times people don't recognize, you know, you go home, you get the prescriptions, and you walk out of your doctor's office and you have these 3 pieces of paper, and you're like, okay, I'm gonna take these prescriptions to the drugstore, and then you come home and you have a pump, a disc, and an egg. And you're like, well, which comes first, the pump or the egg or the disc or the, you know, so it's like, it doesn't make any sense to you, and a lot of times people have this idea that all the medications are created equal, and they're not created equal at all. So don't feel the need to memorize everything I'm about to say, because I'll tell you where you can find this information later. But there's 3 major classes of pulmonary medications, and it's important for you to know that they each do different things so that you can use them properly, okay? Timing of the medications is important. So I don't know how many of you know this, but scream out one type of pulmonary medication.
Advil.
Well, we're hearing brand names, but does anybody know what they do? Okay, so anyone heard of bronchodilator? Okay, so the 2 main classes are bronchodilator and anti-inflammatory. If you have 3 medications, you're going to be taking either bronchodilator or 2 bronchodilators and an anti-inflammatory. But bronchodilators are 2 different types, and I think of it, I've been trying for like 20 years to think of what's the easiest way to explain it, and then one day, I can't believe it hasn't come to me before, but if you think of it as ABC, sounds funny, but the bronchodilators are 2 different types. So there's anticholinergics, A, which is one type. There's beta-2 agonists, which is the second type. And then we have the anti-inflammatories, which are corticosteroids. So I was like, ABC, how could it be simpler than that? And why did it take me 25 years to think of that? But anyway, it's important for you to know what each one of these does so that you can time them to take them to get maximum effectiveness, and so that they last you for the longest period of time, okay? When patients come to my office and they're holding their steroid with them, that tells me that something's probably not right in their understanding of how they take their medications, because you could be short of breath and you could take the whole disc of that steroid and that's not gonna make you less short of breath. And then there's short-acting and long-acting bronchodilators. So it's really important to understand what are you taking, why are you taking it, what does each different thing do, and when should you be taking each one. So 20% medical, having the right doctor, taking the right medications, and then taking them properly means understanding that each one, you know, and they're confusing because each one comes with a different delivery device, and it's really important. Like sometimes I'll see people do this, they'll be like, oh, I'm very short of breath. And we're not trying to like spray a mosquito that got into our house, okay? It's important that these medications get into your lungs where they are going to be effective, okay? So what that means, if you want to take the deepest breath in, that means it's got to start with the deepest breath out, which means Get ready, start breathing in. Okay, if you're not doing it that way and then hold it for 5 seconds to let that medication spread, then you're not getting the maximum benefit from it, okay? Another thing to think about is that it's very important to shake them. It's not, if that liquid is winding up in your mouth, then it's not getting to the lungs where you need it. So we want to shake it up, and if you're taking 2 puffs, then that means you shake it in between each one, because once you've shaken it, once you've sprayed it, then basically that's all gone, okay? The spray and the push that you need to get it into your lungs is gone. Everyone with me so far? Yeah. So medicine, 20%. Having the right doctor, taking the right medications, taking them properly, okay? What's the next 20%? Exercise, okay? There you go. So exercise is so important. Now, if you look at the literature about pulmonary rehabilitation programs of the last 25 years, what they're going to say is this. People feel better, they're less short of breath. Do we see any change in lung function? No. And there's a reason for that, okay? In my opinion, and we've seen, you know, dozens, if not hundreds of cases of improved lung function at our facility, and it's because people are often given a message of take it easy, okay? And so you'll go into some places and someone will be walking on the treadmill at 1 mile per hour for 60 minutes. Or, you know, and it's like, and they say, okay, breathe, and they think that endurance is where it's at, okay? What I have learned over the years is that if you want to get good at something, you have to do that thing. So if you sit on the couch flipping the remote and eating chips, you know that your body gets very good at doing that. It's going to make adjustments. The muscles will adjust, your heart will adjust, your fat will adjust. It's going to make it easier for you to sink back into the memory foam. It's going to remember you next time. I remember that. But anyway, your body gets good at doing what you ask it to do. And one of the things that's happened with cardiac and pulmonary patients over the years is we've become scared of them, or we used to be scared of them. And somebody would come in and they'd be so short of breath and they'd be like, oh my God, I can't breathe. And you know, they'd be blue and they'd be wheezing, and the last thing on somebody's mind would be, I need to start exercising, right? And that makes sense, because if you don't know how to swim, then you're not going in the pool. But what happens with a lot of people is they get this idea where, you know what, my supermarket is 5 blocks up the hill, and they feel like, I don't know if I'm going to be able to catch my breath again. And as the American Lung Association says, if you can't breathe, nothing else matters. So if you don't know if your next breath is going to be your last, then you're going to avoid all those activities that cause you shortness of breath. So here in New York City, the things that I hear most often are walking up subway stairs, running for the bus, walking uphill. So we call that in New York City the New York City Pulmonary Triathlon. So it's up 1 flight of subway stairs, run for the bus, walk uphill. But the problem is that when people start to get short of breath at these high levels of activity, they start to avoid the activities that cause them shortness of breath. And all of the body systems, not just the muscles. Everybody thinks it's that the muscles are getting stronger. The muscles get stronger when we exercise, but it's the muscles, it's the heart muscle. It's all of the systems become less efficient at using oxygen, and you avoid those activities, and now we start to get short of breath at lower levels of activity. And guess what? Now we get short of breath on flat surfaces. So now we're going to cut our distance, okay? And it's not just that we're doing less, but maybe we're doing things differently. And it's very easy. A lot of times people say, well, I'm getting older. You know, well, I haven't been exercising. Well, I gained 20 pounds over the winter. And those are things that it could be. But one thing I hear people talk about is this sort of spiral downhill. And it sounds very morbid, okay? It sounds like when people talk about lung disease, they say, you have COPD, you have an incurable disease, or you have lung cancer, or you have emphysema. So what can I expect? Well, it's going to get worse, and then you're going to die. And you know that we're all going to die, okay, first of all, but the thing is that it doesn't have to be that way, okay? If you do nothing, then it's probably going to get worse until you die. So it's like this. If you, and I hate to talk negatively about sharks because I love sharks, so I'm just using this as an example, okay? But if you fall out of a boat in shark-infested waters, okay? And again, I love sharks. They're my favorite animal on the planet. But if you fall out, okay, and you do nothing, you probably, and I hate to even say it because it's not true, but you'll know what I'm talking about because it's a famous myth. You'll probably get eaten by a shark. but you're really not probably going to, okay? But given the opportunity of wait here in the middle of the ocean and see if I get eaten by a shark, or whatever you might get eaten by, or swim for that island over there, I'm gonna take the choice of swimming for the island. And it's the same thing with lung disease. So if your doctor says, you have an incurable disease, is it incurable? Maybe it is, maybe it's not. But do you wanna sit and wait and find out? Or do you wanna say, you know what, I may go down, but I'm going down with a fight? How many people wanna fight? Yeah. All right. So if you wanna fight, because I promised my secretary I was going to try some Joel Osteen today. If you want to fight and you're with me, take a deep breath in and say, yes, we can. Yes, we can. All right, so here's the thing. The thing about exercise is this. If you look at the average program, okay, going back 25 years, sometimes, okay, the workload is too small to actually get a benefit. Now, it doesn't mean that if you can only walk 10 feet right now, you shouldn't try to walk 12 feet and then 14 feet. Where you are is where you are. However, I don't believe in the idea of you now have shortness of breath, therefore let's find ways to make everything easier for you, okay? Because I just got something, I used to get occasional exercise by pulling the button to get my recliner to come up, and now I've just gotten an auto recliner, so I don't even have to pull that button anymore. So I know my arms are not gonna be as strong after that. But the thing is that you have to understand is that if your life requires this level of activity, okay, so think about the things that you do. Most people get short of breath on stairs, right? Most people get short of breath walking uphill. I know people who can map out this city by where the hills are. I know other people who can map it out where the public bathrooms are, okay? But the thing is that if your life requires this, I can exercise you here till the cows come home and you're still not gonna get better at this. So for all the people that say you need to start taking it easy, I say that's the way that you're gonna get weaker and sicker and get ready for the end, okay? So I say we need to get stronger. Now that doesn't mean go out and say, you know what, I usually walk, 4 blocks, but I'm gonna do the 3-mile run of the lung walk this year. Start easy, and again, get clearance from your doctor. Okay, let's make sure that any symptoms that you're having aren't your heart, because again, we don't like surprises, okay? But then you wanna start out little by little. My recommendation is always gonna be, where available, to join a rehab program, whether it's cardiovascular or pulmonary rehab, because A, I'm biased, B, I own a pulmonary rehab center, but C, I want to make sure that you're safe, and I want to make sure that you're doing the right exercises, and I want to make sure that when you're short of breath, I can say to you, you know what, I know you're short of breath right now, however, or as was mentioned in the one, I could say, my darling, I know that you're struggling, but I am here for you, okay? But I could say, I know you're short of breath. However, your heart rate is okay. I say to you, how much do you think your heart rate is? And they say, oh, it's gotta be at least 150. And I say, would it surprise you to know that your heart rate is 95? And they're like, what? My heart rate's 95, how could that be? And they say, your heart rhythm is good, we see it. I'm looking at what your heart is doing. Let's check your blood pressure. Your blood pressure's okay. Your oxygen is okay. So if you're short of breath right now, but your heart rate and rhythm is good, your blood pressure is good, your oxygen is good, then guess what? I feel like saying, guess what? That bear that you thought it was just your brother. It's not really you. Like that means you're okay. And little by little, your body. See, I see this spiral all the time. And people call it the dyspnea spiral, right? And it says breathlessness, and then it says decreased activity, and then it says more breathlessness, and then it says depression, and then it says even more breathlessness, and then it says social isolation. And I'm like, if that doesn't want to make you kill yourself, then I don't know what would. But the thing is that people have to realize is that in the same way that you spiral downhill, okay, if you start to do some of these behaviors and make some of these changes, okay, you can spiral back up that hill. So you can become more active, your muscles can get stronger, your heart can become more efficient. Now, when we talk about oxygen use, your body's oxygen use is based on 3 main things. Number 1, how good are your lungs at moving air in and out? How good is your heart at pumping blood? How good are your muscles at using oxygen? All 3 get better with activity. All 3 get worse with inactivity. Now, Are we going to restore you to the heart that you had when you were 21 years old? Probably not. But if you think of it like a car, if your oil filter is dirty, if you don't have the right amount of air in your tires, if your spark plugs are old, then you're going to get less miles per gallon. Now, if we only change one of those things, okay, because a lot of people say, my lungs are so bad I can't make any changes. But if we change even one of those things, then the overall efficiency of the car gets better, and it's the same thing with your body. If we change 2 of those things, that's even better. It multiplies. And if we change 3 of those things, that's great. So very quickly, I don't want to make this a long lecture on exercise, but there's 4 things you could change about exercise: frequency, intensity, time, and type of exercise. Okay, frequency, you should be doing something every day. It doesn't have to be going to the gym, it doesn't have to be going to the track, but you should be walking, okay? Track your steps. Fitbits are awesome ways, and if you can only start out at 50 steps, then so be it. Next day you're gonna go for 60 steps. So you should be doing some type of activity every day. Think of yourself and your lungs and your muscles as wax or jello, okay? You want to stir that pot, because if you don't stir that pot, that jello starts to congeal, okay? That wax, if you don't keep it moving, that wax starts to get harder. So frequency, intensity is going to be determined by your doctor, but I think you should work out as hard as you can safely, and that means we find out what is actually safe for you. One of the mistakes that people make is they get these stress tests on a treadmill, and the typical treadmill test that people get is called the Bruce protocol, and it starts at 1.7 miles per hour with a 10% incline, and people get on it, and for the average person, my average patient is 80, average. So 80 is middle age at our place, okay? 100 is senior citizen. But the thing is that for most of my patients, 1.7 miles per hour and 10% incline will throw you across the room. And so what winds up happening is a lot of times the tests are stopped, but they're not stopped for a cardiovascular reason. They're stopped because you're short of breath and because your legs hurt. And that makes it, not exactly the right test for pulmonary patients. Time, how much should you exercise? You should exercise as much as you can. So if you're doing 0 right now, I don't want you to go up to the gym and do a 1-hour workout, okay? But I'd like you to start with 5-minute goal. If you start at 5 minutes and you add 1 minute a day, in 2 months, you're gonna be doing an hour. Even shorter than 2 months, in 55 days, you can be doing an hour. And people have to think long term, okay? Same thing with weight loss. If you lose a half a pound a week and you keep it up, in 1 year, you've just lost 26 pounds, okay? So think long term. And then in terms of type of exercise, I think aerobics has to be first. So walking is a great aerobic exercise. Things like treadmill, bike, upper body ergometer, things like that. Strength training is also good, flexibility training, breathing retraining. But sometimes people get too caught up in the details. So they say, I need aerobic training, so this is aerobic, or this is strength, and they think it's very, very cut and dry. The fact of the matter is that even walking is some strengthening, is some aerobic, is some flexibility. So again, if you're used to doing nothing but watching TV or eating or cooking or this and that, if that's all you do, then any exercise you do is going to be a plus for you, okay? So number 1, medical, having the right doctor, taking the right medications, taking them properly. Exercise, okay, 20%. Next, nutrition. Now here's the thing. Nutrition for the pulmonary patient is not the same as nutrition for everybody else, and that is something that gets me very irritated. We've had 12 nutritionists at our center over the past 18 years, and we've not kept any of them. I decided that I better make myself an expert on pulmonary nutrition because nobody gets it, okay? And what people don't understand is that what's great for the cardiovascular patient may be terrible for the pulmonary patient, okay? How many people, if you think that carbs are the healthiest, if you think protein's the healthiest, if you think fat's the healthiest, how many people think protein's the healthiest? How many people think fat? How many people think carbs? How many people don't think about it? Okay, so here's the thing. There's something called the respiratory quotient, okay? If you go to most nutritionists, they're gonna try to recommend to you a low-fat, high-carb, good amount of protein type of program, but what they don't understand is that when you eat a high-carbohydrate meal, okay, the byproduct of carbohydrate metabolism is, well, it is sugar, but I'm talking about respiratory system, carbon dioxide. Okay, there's something called a respiratory quotient, which means that the carbohydrate metabolism will create more carbon dioxide than protein or fat. And you know what carbon dioxide does? It sends a signal to your brain that says, breathe, 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 breathe. So a story that I hear from a lot of patients is, I don't understand what happened. I went out with my wife for dinner the other day, and I'm going to start talking faster because I know I'm running short. 5 minutes? I have 7 by my watch. But anyway, so I went out to dinner with my wife the other day. We walked to the restaurant, and when I got home, I don't understand this, we walked a block and we had to take a taxi. Sound familiar? Okay, so here's where nutrition gets important. I'm going to do nutrition in 2 minutes. When you eat, the food winds up in your stomach and your abdominal contents. What sits right above your abdomen? The diaphragm, right? The diaphragm contracts downward. That creates a negative pressure. That's what inflates the lung. So now think about this. I say to the patient, well, what'd you have for dinner? Pasta, okay? So pasta is high carbohydrate meal, right? But let's say you had a giant meal. Did you have an appetizer? Yeah. Did you have pasta? Yeah. Did you have dessert? Yeah. Did you have a drink? Yeah. Here it is, all sitting right here. And now my diaphragm, which is used to doing this, okay, is now doing, and you wonder why you can't take a deep breath, right? Now add to that fact, the fact that you had a high carbohydrate meal and now it's spilling carbon dioxide into your blood. And what sends the message to your brain to breathe? It's increases in carbon dioxide, low oxygen, high acidity or high concentrations of hydrogen ion. So now we've just said to the body, we have a problem here. Our boat is filling up with carbon dioxide, and it's going to say to you, breathe, 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 breathe. So now you're trying to breathe, right? And you're trying to bail, but you are now mechanically limited by this. And so that's why you have to take the taxi home. The other thing is that nutrition is very important because if you're overweight, okay, think of 25 pounds right here. Or let me make it easy for you. Think of 25 pounds right here. A bowling ball is 12 and a half pounds for some of you, right? Imagine 2 bowling balls or 1 bowling ball hanging off each side of your ribs. It's going to be hard to take a breath. And then the converse of this is that for people who have difficulty gaining weight. And it's not simply an opposite problem, okay? What people don't realize is that breathing is very, very hard, okay? You spend so much work and energy breathing all day that you're burning much more calories than the average person, and you can't take those deep breaths because you can't have enough calories or those big meals because it makes you short of breath. Again, I usually give this talk that I'm giving right now, 4 minutes left, over the course of about 8 to 12 hours. Okay, so if you guys are good till about 10 o'clock tonight, I can keep going. But so I'm going to talk about nutrition. So we talked about having the right doctor, taking the right medications, taking them properly, exercise, nutrition. What's next? Stress management and anxiety. Okay, is it anxiety provoking to not be able to breathe? Jeff, come up here and put your neck in my hand. No, I'm just kidding. But the point is, of course it is. If you can't breathe, that's going to cause anxiety, okay? And you know what that does to your body. So our brain is now getting a signal, we can't breathe. What is it going to do? It's going to try to make you breathe by putting adrenaline out into the system. This is the fight-flight response, right? The autonomic nervous system, sympathetic nervous system, which is there just in case a bear is chasing us, we need to fight this off, but it's going to make us breathe. If you're just sitting here doing nothing and you're having a hard time breathing, you don't need all that adrenaline, and that's going to make you more short of breath. So stress management. Is it, and as you saw from the previous presentation, is it depressing to have a disease like this? It could be, okay? But it could be. No one's gonna be like, great, I have COPD. It doesn't work that way. But the thing is, it's even worse if you do nothing about it and you wait. And again, I love sharks, but if you're waiting for these sea creatures to get you, and you're waiting for COPD to get you, a lot of times people ask me, what's going to happen to me in my last minutes? Nobody knows the answer to that, and it may be totally different for every single person, and it may be just like any other person, but you have to address the anxiety, depression, through deep breathing exercises. But think about that spiral. Again, if we've gone downhill, and that makes us depressed, if we start working our way uphill, all of a sudden we say, hey, you know what? I wasn't able to do this the other day, and now I can go to the mall again. It's cyclical, and these things work in cycles. I know I have 2 minutes left. Last 20%, prevention of infection. So if you have any type of chronic disease and you're your immune system is not going to be the same as everybody else's immune system. So a cold to me is not the same as a cold to you, or a cold to you is not the same as a cold to me. And you have to think about these things from a proactive perspective. Viruses, bacteria, it's everywhere you go. So how do we prevent that as best we can? What's the number one way? Wash your hands, right? We don't know who was on the subway right before us. Maybe it was Typhoid Mary, and she was holding on right where I'm holding on. And now I am bringing this to my face, and now I am bringing everything that was on that pole right into my home. So number one, you may not be able to wash your hands right at that moment. So carry some antibacterial cream with you at all times, so that at least I know. Anyone have this lovely New York experience where you get into a taxi and the seat is wet? So it's like, you don't know what that is, but I know I want it off of me as quickly as possible. I don't care what part, But the point is, you have to take control of that. Other ways, pneumonia shot, okay? Speak to your doctor. You want to be vaccinated for pneumonia. You want to have the flu shot, and you want to avoid sick people. That's ultimate pulmonary wellness as I see it. 5 things. Number 1, medical, having the right doctor, taking the right medications, taking them properly. Number 2, exercise. Number 3, nutrition. Number 4, stress management, relaxation training, anxiety management. Number 5, prevention of infection. Again, honestly, these are things that I could talk about from now until next week, okay? Through the help of the American Lung Association, I have created a series called the Ultimate Pulmonary Wellness Webinar Series. All these things are up on our website in great detail for an hour to 2 hours at a pop, depending upon how much Red Bull I've had the day before, okay? So I'm gonna leave it there because I know that what? 1 more hour? Awesome. So I have 1 more hour. So that's perfect. So let's go back to the beginning. No, I think that's it, but there's a lot there, okay? I hate when someone gives me 30 minutes because it's like a fraction of what I really need. But this stuff is available to you, and we have brochures to link you to the website before you leave if you want them. Shameless plug over. Any questions?
Could you repeat the website again?
This is my office manager, Caroline. Caroline, stand up, please. Caroline will be at the back. She will have our brochure, and that will link you to all of our stuff. So thank you very much. I know it was fast, but